sharing and please join. Okay, question number 41. A nurse is caring for a adult son with type 1 diabetes. Which findings are emergent? Blood glucose 32 mmol per liter, Kusumal respiration with fruity breath, blood glucose 3.1, and complain of nausea, abdominal pain, or hemoglobin A1C is 8.0. ABC. Okay, let's go to option A, guys. Blood glucose 32. Is it low or is it high? Low or 580 mg? Are you guys already sure? Hi, just Nazia, yes. Queen, thank you. It is critically high. Okay, blood glucose of 32 mmol per liter is critical high. Okay, the normal level is, we will expect, like if fasting it will be 3.9 to 5.5. If it is 2 hour after meal it will be 7.8 around. So this is critical high, so we need to worry about this one. Okay, because it is sign of diabetic ketoacidosis, and that's why you're gonna see option number B in that patient. Okay, yes, DKA is going on, and that's the reason you're gonna see Kushmal respiration with fruity breath. Okay, body is trying to compensate for severe acidosis and trying to get rid of those one, and that's why you have that respiration. So signs of decay, so we need to worry about B also now. Okay, what about C? Blood glucose 3.1. Blood glucose 3.1. Low. Yes, but do we need, these are emergent finding. Okay, so we need to worry, especially in type 1 diabetes. Okay, high is critical also and low is critical also. Okay, if patient is coming with blood glucose 3.1 mmol, it is critical level of hypoglycemia. Okay, and it can lead to seizure, it can do the brain damage, it can, low worse than high. Okay, so C is concerning also. What about D, guys? Complaint of nausea, abdominal pain. Is it okay or can we sort it out? Yes, we need to. This is common symptom of DKA, but it is a serious finding. Okay, because now we know it is expected sign of DKA. Okay, now we know DKA is going on, so we need to sort this out. Okay, that's why this is emerging, that's why this is causing letting us know, okay, you guys need to act fast. And what about hemoglobin 8.0? It's A1C. This is very helpful for LPN also. Yeah, this is helpful for LPN also. Yeah, hemoglobin 8.0, is it normal? High but not emergent. Yes, 6.5, 7.5 is normal, so 8.0 is slightly high, but it is not concerning, it is not life threatening, so we don't need to worry about that right now. Okay, so we still have bit of time. Alrighty, let's move to question number 42. A nurse is caring for a child with a tracheostomy. Which situation require immediate action? Select all that apply. Dislodged tracheostomy tube in a fresh stoma, Copious secretion and O2 set is sitting at 85%, minor bleeding at stoma site, accidental decannulation in a mature stoma, or no breathe sound after suctioning. What are the options, guys? What about A? A, B, D, E? Let's find out all. Okay, let's find out. A, yes. Everyone happy with A? Because it's fresh stoma and we are having dislodged tube, so that's why it is concerning. It is immediate and critical threat, so we need to worry about this one. So A is yes. What about B? Copious secretion, O2 sat 85. BEAD, yeah. B, yes, low O2. Okay. Here, when we are having copious secretion, that can indicate like the airway is obstructed. So that's why you are having low as O2. So this is concerning, and anyway, 85 is very concerning. So we will definitely look after that one. Minor bleeding at stoma site. What about C, guys? Is it concerning or is it normal? This is expected, yes. Okay, minor bleeding is a common and expected sign, so this is not gonna, and anyway it's minor, so we are not gonna worry about right now. It doesn't require the immediate action. Accidental decannulation in a mature stoma. What about D? Just T2K minor is okay over there, it is expected. What about D, guys? Yes or no? Okay, if I know decannulation is always concerning, but make sure we know like it's mature stoma, so we don't need to worry about that one. Okay, we need to worry, we definitely need to worry about, but like not we can, a nurse can do that. Okay, nurse can reinsert the cannula without any critical emergency intervention. Yeah, that's why D is okay, D is fine, we can sort out. It is not immediate action requirement. Okay, but if it is like fresh stoma, likewise we discussed between 7 to 10 days, it's less than 7 to 10 days, then definitely we need to secure the airway. Yeah, I will not say it can wait, but I will say it doesn't require like that much intervention. A nurse can do that. If we pick one wrong answer, will it mark the entire question wrong? No, it is it. Now you have partial marks also, so it's not gonna give you wrong for all the what we will say, for all the question. Okay, you will still receive partial marks for correct question. No breathe sound after suctioning. What about this, guys? What about E? Is E concerning? Yeah, you get partial credit, definitely. Is concerning? Yes, yes, definitely, because you wanna make sure there are breathe sounds after suctioning, because if there is no breathe sound, there can be mucus plug, there can be other airway obstruction, that means there is nothing going on. Okay, alrighty, so E is good. Okay, so we will look after A, B, and E. Yeah, let's move to 43. So the nurse is caring for a pediatric patient post tonsillectomy which are emergent. Select all that apply. A, frequent swallowing, vomiting, bright red blood, white patches in throat on day 2, Heart rate is 150 and pillar or mid-ear pain with swallowing. Okay, what about A, guys? Isn't it the classical sign of post-tonsillectomy hemorrhage? Yes? Yes. Okay, so whenever we have patient with post-tonsillectomy, um, we need to observe whether patient is doing frequent swallowing, because that's indicating hemorrhage. Alrighty, and it can be life-threatening. It can be need immediate surgical intervention. So we need to send patient back to OR. Okay, vomiting, bright red blood. What about B, guys? So B is yes, yes, definitely. Okay, because if it is bright red blood, that is active bleeding going on, active hemorrhage going on. So that's why we need to cover B also. What about C, white patches in throat on day 2? Is it normal? Is white patches on day 2? Is it okay? Is it normal or is it concerning for us? Anything? Anyone about C? Concerning? Actually, it is not concerning, okay? The only reason is because it is indicating healing, okay? And it is normal, it is expected finding, and it is not a concern at all, okay? Yeah, thank you. Heart rate of 150 and pillar. What about D? What about D, guys? And it doesn't indicate infection because like over there mucosa is healing and definitely it's gonna have white color. Okay. D is yes, D is definitely yes. We are having high heart rate, tachycardia, and we are having pale skin also, paler, and that is indicating compensating sign of hypovolemic shock. Okay, and that can be caused by hemorrhage that patient is already having. Okay, mild ear pain when swallowing. What about E, guys? Is E concerning or not? What about E? It is expected sign. Patient just gone through surgery. Patient, you know, because the pain radiate from throat to ear, so it is expected sign. And anyway, it's not life-threatening emergency. So yeah, you're gonna see pain. Yeah, and ear, neck, throat is always connected. So ear pain is also common. So we are gonna only see A, B, and D in this patient. Alrighty, let's move to next one. Question number 44. So a nurse is assessing an adolescent admitted for suicide attempt, which require priority intervention. So now we are just doing prioritization in mental health nursing, and in mental health nursing is always about patient safety, especially about risk of harm to self and others. So we need, as a nurse, we need to quickly identify and intervene. Okay, if patient is having a clear plan of suicide or threat to others. So let's do that. A patient with access to sharp object in a room, is it a safety risk? A yes, yes. So that can be the safety risk, sharp object. So we need to intervene early to remove that object. This is a top priority. Okay, a patient expressing a plan to overdose again. What about B, guys? B, yes. And especially someone, when you see word like again, this is indicating that patient has already tried that in the past and having more tendency to do that. Okay, so definitely we need to look after B. And what we can do, we can put a change of care of plan and how we gonna make it safe. Okay, this is the patient that usually require one-on-one observation because already attempted suicide in past. Okay, what about C, guys? Patient requesting to be left alone. Is it okay? What about C? Not okay. C, yes. Um. So what can happen as long as I think so, because it is common finding most of the mental health patients, we when they go through like depression, they want to be left alone. Okay, we wanna make sure like um they don't have anything else, in hand, and they can't use to attempt another suicide. But we can respect their rights, we can respect their request also. So if someone is requesting to be left alone, we can so we are just assessing. Okay, so we can, yeah, yeah, that's what I'm saying, Queen. We can leave them alone, but we need to assess the safety to environment. Yes, definitely, whether they will be fine, is there anything in the room that they can use. And usually when we have patient like that, because otherwise what will happen, see, you can't be with them all the time. Okay, you can't be with them all the time, so most important thing is providing safe environment. Okay, and if somebody is getting admitted, there is always plans. So we, if somebody is just asking they want to be left alone, that is not the indication of suicide attempt. Okay, that is not always indicated a indication of suicide attempt. So we're gonna go no with this one as compared to other, because the other one is straight saying, showing the suicidal ideation. Okay, okay, patient refusing to attend group therapy. What about D, guys? D, no. Yes, again, same rationale, because there can be social withdrawal. They don't want to be other with others, and they don't want to attempt the, attend the group therapy. So that's fine. That's fine. We don't need to force. Yeah, they may have anxiety. Okay, patient giving away personal belonging. What about E, guys? Yes, yes, because that's always the sign, that's always the indication. Like if somebody is donating personal belonging and giving it to someone else, it is critical finding. They may have a plan. Yes, yes, guys, it is a key sign. Okay, so E is definitely just over there. Alrighty, let's move to question number 45. And this is the mental health is the one of the nursing where you guys can straight ask, are you thinking about this? Okay, cheating, that's because when people start giving stuff away, they always, it is indicated of a plan that okay, they're gonna have a suicide or they're gonna attempt it. Okay, okay, nurse is caring for a patient in alcohol withdrawal. Which finding are priority? Which finding are priority? A. New onset confusion, agitation. B. Tremor, diaphoresis. C. Seizure activity. D. BP is 190, 110, and heart rate is 120. And E is nausea and vomiting. A, B, C, D. A, C, D. Yes, Nadia. Okay, let's go with A first because most of A's are over there. So, likewise, we discussed in one of the last question that everything is new onset is concerning. Okay, everything new onset is concerning. So if it is confusion and agitation especially, it is classical sign of DT, that is delirium tremens. So it is classic sign of DT. So it can cause severe disorientation, agitation, hallucinations. So this need to be sorted about. Okay, B, tremors and diaphoresis. What about B? Is it common sign? Is it expected? Yes, thank you, Ru. So when we have alcohol withdrawal symptom, tremors and diaphoresis is expected sign. Okay, they can be managed. It is not immediately life threatening, so we don't need to worry about B. What about C, guys? Seizure activities. Is it expected or is it something that we need to look after? Is C priority? Yeah. Um, it is life-threatening complication actually. Okay, severe hypertension. No, C. We are talking about C. Seizures. Okay, because we have status epileptics, and as usually see in alcohol withdrawal, it is life-threatening complications. We need to intervene. It is critical neurological emergency. Okay, so C is definitely yes. And D, high blood pressure. Even though D is expected because autonomic hyperactivity happen, but D is concerning. When we have such high blood pressure, it can cause stroke, it can cause heart attack, it can cause cardiac arrest, especially in patient with alcohol withdrawal. So we need to worry about that. Yeah. And what about E, guys? Nausea, vomiting. Is there anything concerning going on? Expected. Yeah. So is expected. We don't need to worry about that one. It's not immediate life threatening if somebody is having nausea, vomiting after alcohol withdrawal symptoms. So it's okay. Okay, let's move to question number 46. We only have 5 questions left for today. Make sure you guys follow YouTube because all of these questions will be posted on YouTube. Likewise, all of our previous lives, all the previous question is already posted on YouTube. So this will be there too. If you have missed the session, make sure you search Nursingi and then you can find it. Okay, the nurse is caring for a patient with schizophrenia which require immediate action. Select all that apply. A patient stating voices are telling them to harm other. Patient withdrawn and refusing to eat. Patient pacing with clenched fist and shouting. Patient responding to auditory hallucination quietly, or patient with EPS symptoms after haloperidol. Okay, what about A, guys? Which patient require immediate action? A, C, D, A, yes. Okay, let's do A first. So we know when patient is telling them to harm others, we always think about safety of others, safety of ourselves. So if some voices are telling him to harm other, that means it's immediate threat to others. Okay, so we need to watch this patient especially. Okay, what about B, patient withdrawn and refused to eat? Is it concerning? Is B concerning? No, just zero, because it is common finding to have social withdrawal, especially in schizophrenia. Um, I know they need to be addressed because of their nutritional, whether they are taking adequate nutrition or not, or social interaction, but it is not immediate life threatening emergency. Okay, so we don't need to, we can exclude B. Yes, Dina, definitely. Okay, patient pacing with clenched fist and shouting. C. What's happening with C? Yes. Okay, C is just because it's indicating that patient can lead to agitation and violence. So nurse need to intervene to calm down the situation, de-escalate the situation, because otherwise it can lead to harm to the patient or others. Okay, so we need to sort out C also. Okay, D, patient responding to auditory hallucination quietly. This they do have hallucination, and that is part of schizophrenia, and they are listening to it quietly. So is it concerning? That's expected, yeah. And patient is sorting himself by himself, so we don't need to worry about D also. And what about E, patient with extrapyramidal symptoms after haloperidol? What about E, guys? Is it expected? Okay, E is also wrong. Okay, E is also wrong. The reason, because we know in typical antipsychotic medication, first generation antipsychotic medication, they work on dopamine receptor. So EPS symptoms are expected in that one. Okay, so we don't need to worry about that one. Okay, we can titrate the medication, we can titrate the dose, we can switch to atypical. Okay, second generation or maybe other medications. So there is chance, and it's not life threatening, it's not life threatening. So that's why we definitely I can explain EPS. uh, So, if the early easy way to remember EPS symptom is TADAP, okay, TADAP. So that's how I remembered EPS symptoms, because typical medications, like haloperidol, they work just on dopamine. Okay, they just work on dopamine, and that's why they have the EPS symptom. The atypical one, second generation one, they work on dopamine also, and they work on serotonin receptor also, and that's why you will see um, less symptom in atypical medication. So we have dystonia, so, and we have akathisia, we have parkinsonism, we have tardive dyskinesia. Okay, so it's four symptoms that we need to look after. So dystonia is painful, dystonia, painful involuntary muscle contraction. Akathisia, like patient will not feel like sitting at one place, and there is inner restlessness, too much agitation going inside the patient. And we know Parkinson symptom, like there is like slow movements, like tremors, like muscle stiffness will be there. Tardive dyskinesia will be like, you know, how I can, like chewing, like continuous lip movement, chewing, tongue movement. There will be some swelling or puffiness on face. Okay, so easy way to remember that is TADAP. Okay, yeah, TAD is like tardive dyskinesia, A is akathisia, d- and P is Parkinsonism. So, is it non-therapeutic symptom? These are extrapyramidal. It is kind of side effect. Okay, these are kind of side effects, so we need to watch for these one. And we can have like provider to change the medication to second generation. We can do some pharma also, and I will actually make a video on those one, and I can post it. Okay, question number 47. We only have 4 questions left. Yeah. A nurse is caring for a patient with bipolar disorder in mania. Which findings are priority? Patient refusing to eat or sleep, patient pacing in hallway with exhaustion, patient yelling at others and threatening violence, patient making excessive financial purchases online, and patient neglecting hygiene. 47, guys. What is correct? DE. Okay, let's go to A. Patient refusing to eat or sleep. Is it concerning? Because we have patient with bipolar. Okay, and he's in manic state right now. What can happen? Because if, yeah, physiological need. Okay, so if patient is not eating, if patient is not sleeping, then what can happen? There is a higher risk of physical exhaustion, dehydration, and physical health can decline. Okay, so that's why we need to look after this part. Okay, that's why we need to check on this patient. Okay, if they will not sleep on time, if they will not eat on time, it's concerning, guys. Okay, patient pacing in hallway with exhaustion. B. Yes, yes, definitely. Okay, B, because we know patient is already exhausted and he's still pacing. If he will keep pacing and already exhausted, it can deteriorate physical health, it can cause the physical collapse, it need immediate, yeah, yeah, can cause the heart to overwork. Thank you. So B is there. Okay, what about C? Patient yelling at others and threatening violence. C is yes. Yeah, because I will put C yes also about safety. If he is threatening others, it can be safety concern. Yes, yes, Winnie, definitely. Okay, so C is always, and safety is always priority in mental health and other health also, definitely, but mental health, safety. Okay, the patient making excessive financial purchases online. Is it okay? They can have fun, they can do. Yeah. D, no, yes. Okay, so D can be normal. It's not life threatening if somebody is spending too much money. Okay, patient neglecting hygiene. Is neglecting hygiene life threatening? Or E is okay also? Yeah, is more, the thing is that because patient is going through manic state, so whenever he will come out from that manic state, definitely he will listen or he will follow the routine. So is not concerning life threatening, is expected. In manic state we really don't wanna push or prompt patient that much. We want calm, we want de-escalation techniques over there. Okay, not priority. So only ABC is priority. Let's move to question number 48. Okay, in nurses caring for a patient with major depression which require immediate intervention, select all that apply. A patient expresses hopelessness and has a suicide plan. Patient B reports decreased appetite and insomnia. Patient give away favorite personal items. And D is patient refuse morning medication. And E is patient write a goodbye note to family. Okay, we have done similar question just I think two questions before. A is yes, yeah, because who already had a suicide plan, safety concern, we will need to intervene. One on one observation. What about B? Patient report decrease appetite and insomnia. Is it concern? Okay, B is I want to say, but yeah, that's what we need. We don't need to say yes to this one because we are seeing patient here with major depression. Okay, so when they do have social withdrawal, they do have insomnia, they don't want to talk to anyone, so it's wrong. Okay, so this is not right. This is not right. What about C, guys? Patient give away favorite personal item. Um, Patient give a favorite. Yes, because that's the key sign that somebody is gonna have plan. Why the schizophrenic patient is expected when refusing to eat, but not bipolar disorder patient in manic? Because Queen, they both are different. They both are different. Okay, because bipolar come and go. They have manic stage. They don't. They have calm stage also, and schizophrenic because they listen to the voices. There is hallucination. There is delusion going on. Okay, so they both are different. What we will say, they have both different manifestations, symptoms. Yeah, and if bipolar is like whenever they are normal, they will start working normally, they will start eating normally, they will go back to their routine. But in schizophrenic, it's very hard to go back to routine. They can keep getting worse and worse. Okay, so we need to prompt the routine for them. Okay, patient refuse morning medication. Is D okay? Expected? They can refuse the medication. It's not a concerning sign. Yeah, it doesn't require immediate action. Okay, it doesn't require immediate. We can go back. We can check on later if they are okay to have medication now. So we will do that. What about E? Patient write a goodbye notes to family. So E is yes. Yeah, they are saying goodbye. It is concerning sign. They might have planned to hurt themselves. So E is sign. So only A, C, and E. Okay, we have two more questions left, 49 and 50. And that's we done with prioritization. Tomorrow we will be live, same time, 3 p.m. New York time EST on cardiovascular. Okay, so please follow YouTube also. This live will be uploaded there as all other lives are uploaded there already. The nurse is caring for a patient withdrawing from opioids. Which findings are priority? Select all that apply. Okay, first is severe vomiting and diarrhea leading to dehydration, heart rate 120 with hypertension, anxiety and restlessness, suicidal ideation with agitation, and muscle ache, rhinorrhea. Okay, ABC, let's do that. Okay, severe vomiting, diarrhea leading to dehydration, concerning. A is yes, A is definitely yes. Okay, because due to opioid, now withdrawing from opioid, it can cause dehydration, it can cause electrolyte imbalance, so this is concerning. Okay, if we don't sort out on time, then it can cause hypovolemic shock. Okay, fluid balance problem will be there. Okay, heart rate 120 with hypertension. Yes, B is definitely just because we just done that question today where we discuss if like patient is having tachycardia and high blood pressure, it can be severe autonomic hyperactivity and heart overworking, definitely. And it is a key component of opioid withdrawal. So it can lead to heart attack, it can lead to stroke. So we need to keep eye on this and monitor. Okay. What about anxiety and restlessness? Is it expected? Is C no? Yeah, and it is not um, life threatening, definitely. So anxiety is common. Suicidal ideation with agitation. This is concerning. Anything suicidal ideation is concerning, regardless wherever it come from. Okay, so it is about safety. It is for safety of patients. So we need to. Um, Yes, Tashi B is not life threatening, but heart rate is body is trying to compensate on that time, and especially when somebody is having opioid withdrawal, there can be autonomic hyperactivity. Okay, body is trying to compensate too much, and that can lead. It's priority like we are gonna monitor that patient. Okay, we are gonna monitor that patient. Okay, E muscle ache and rhinorrhea. Runny nose is yes, muscle ache. Again, this is common. Okay, this is common. Expected is uncomfortable. Yeah, heart rate 120 is okay. Yeah, no management required. But that's what I'm saying. We will just monitor that patient. Okay. Yeah, because it can increase. It can increase. Yes, E is expected. E is expected and common sign of opioid withdrawal. Okay, muscle ache, having muscle ache and runny nose. So no, not increase ICP everywhere. This is the thing. Yeah, it's not life threatening. Okay, we will move to last. Yeah, we will move to last question of today's session. Thank you guys who joined. Make sure you subscribe on YouTube because all the live sessions are being uploaded there. Just Tashi, we can do A and D, okay? Yeah, answer is A and D. Thank you, Tashi. Okay, we will make it normal. Okay, let's do that. Here you go. Okay, let's move to question 50. A nurse is caring for a patient with generalized anxiety disorder. Which findings are urgent? Select all that apply. Patient hyperventilating with tinglings in hand. Patient pacing and unable to follow instructions. Patient reporting chest pain and palpitation. Patient requesting PRN anxiolytic medication, or patient reporting mild restlessness before exam. Okay, which one? Let's do individual and then we can end our session for today. We will come back tomorrow again, same time, with cardiovascular diseases, medications, and nursing considerations. Okay. ABC. Thank you, Vinny. Let's do A first. Patient hyperventilating with tingling in hand. We have done that before. We have done in few of our lives before also, because what's going on? Paresthesia. Yeah, so A is definitely yes. Paresthesia is going on here, especially when there is a hyper. Yeah, hyperventilation, it can be breathing concern. We immediately need to sort out like what's going on to prevent the further complications. Okay, so we need to check whether patient is hypoxic, having enough oxygen, or panic attack, or yeah. So A is concerning. Patient pacing. And what about B, guys? Is B yes? B yes. Okay, so because it can escalate when they are not following the instruction, especially in GAD, generalized anxiety disorder. It can lead to panic attack, and we really don't want to see patients in panic attack. Okay, so B is yes. And what about C? Patient reporting chest pain and palpitation. C yes. Yeah, ABC, yes, definitely. Because we need to rule out here cardiac event, whether it's a chest pain or palpitation related to any cardiac event. So we want to make sure we rule out that one. Okay. And we don't want to say it's anxiety. So that's why we need to